So today we're going to talk about a very important topic, which I'm actually surprised we don't talk about it openly in our community, and that is living wills and advanced care planning. So my take on this is you're born, you're going to die. So why not plan how your exit should be in terms of like, oh, no, it's true. Like, what kind of funeral do you want? Like, who are you going to give your jewelry to? All that kind of stuff.
Yeah, plan it like you're planning a wedding.
So that it doesn't put people aren't fighting afterwards or they're confused trying to please you. So I think that's one topic. And the other one we're talking about is advanced care planning. So what to do when
I mean, we all think about it as being important for our generation, but I think the problem is that the generation older than us doesn't talk about it. That's why we kind of wanted to do this podcast.
Yeah.
So welcome to Avaz. We're the podcast for South Asian women's health and wellness issues. And we talk about issues that cover more than just South Asian women and more than just health and wellness because it impacts our families. And so today, as we heard from Dr. Madhu and Dr. Nav, we are going to be talking about advanced care planning. And we are going to be talking about things like will, power of attorney, a living will, and various other topics that relate to it. And so you may know the word will as vasiyat, which is also your itcha or your desires or your choices. And it's really important to make those choices while you are living so that once you pass away, the people in your family, your close family, friends, your loved ones know what exactly it is that you wish for. So why are we talking about advanced care planning today?
Well, I think it's important in the South Asian culture to discuss wills and advanced care planning because we don't talk about it. And there's a lot of reasons we don't talk about it. I think we don't want to be disrespectful to our elders. We don't want to, wish them that, we want you to die or something. Like it's sort of, a bad omen. We're not talking to them properly. So I think those are some of the reasons. What else have you seen in your experience?
I think also people like elderly, especially the elder generation, they're just thinking it's basically fate. It's God's will. Jo kuch hona hona. So they don't want to have to think about it ahead of time. And also, I've noticed that a lot of our elders are also, they have this, not attitude, I was just going to say this thought that their healthcare practitioners are, very authoritarian and that they will just do exactly what their healthcare provider says. And they don't want to have any say. They don't want that autonomy either for themselves, or they don't want to have the autonomy with their family members. So they just want others to make those decisions for them, especially their children, their generation.
And in South Asian families, often, there is the male who is head of the family, and typically they'll say, well, we rely on our son or our son-in-law, even though it's probably their daughter or daughter-in-law that's doing most of the care for them. But they have their own wishes, so why not, right?
I think they want to say, okay, well, when it happens, the younger ones will decide, and the younger generation goes, well, we don't want that responsibility. We would like some direction.
Yeah.
And I honestly think from my personal experience, having that direction, you're already under a lot of stress when someone passes away. So to already have in plan that this is what's going to happen, it makes it very easier for the people who are mourning. And there's so much other stuff left to do afterwards when someone passes away.
And then there's no disagreement either because it's written down what you would like. So no, you're not going to have one sibling arguing with another about, well, I think mom wanted this. I think she wanted that.
And why not be open? You're going to die. So we have a will already. I'm sure you do.
Mm-hmm.
You do.
Yeah.
And then I know as I got older, my dad said, well, here's my will. Look at it. If there's something you don't like about it, tell me now. Don't tell me when I kick the bucket.
Yeah.
And he's right.
Yeah.
And I'm like, no, it's fine, whatever. But I love that openness, which is very uncommon in our culture.
Right.
Yeah. So the first part of advanced care planning is the will itself.
Mm-hmm.
And this is a legal document. So let's talk a little bit about that.
Yeah. So we will just kind of briefly touch upon wills because that's more of as you said, legal document. Yeah. So it doesn't really pertain to the majority of our conversation.
So advanced care planning is different than a will. Mm-hmm. So a will is after you've passed away, what happens with your assets, whatever.
Yeah.
Advanced care planning, take it away, Dr.
Yeah. So advanced care planning is basically a process by which you determine what your values, what your beliefs, your morals are, and how you want to plan for your care in the future. So your medical, your health care in the future, should you get to a point where you're incapacitated enough, whether because of cognitive decline like dementia or severe physical illness, that you can't make that decision for yourself. So you basically find a substitute decision decision maker that will make that decision for you. And most of the time, that substitute decision maker is somebody that you've legally appointed and you've chosen yourself. So whether it's your child, grandchild if they're old enough, usually it's not your spouse, believe it or not. It's usually your child that comes first. So it's a very sort of legal, thorough way to ensure that your wishes for your future medical care are determined ahead of time.
And some examples of that might be, if I'm in a coma, I want to be put on the machines for maybe 2 months, or maybe I want to be turned off right away. So it's those sorts of specific, perhaps medical.
I'm gonna give a bit of a nuance here. So it's not that simple that you're in a coma and you're gonna, if there's no scope of survival, the physicians will inform the family.
Yeah.
They're not just going to keep you on a ventilator for 2 months, because that's not good medical practice. So what it is if you've had, let's say, a stroke or a heart attack, and how far do you want to go? If you're 96 years old, let's say, and you have a heart attack, do you want to be fully resuscitated, or do you want to have a tube put in? So it's very specific things that a person who's trained in this, your physician or even a lawyer, can go through it with you, and you can have some sort of a document.
Yeah, because most people, I would say like 3/4 of people who get to that age, they they're not able to participate in those decisions when it comes to that point. And actually, like half of Canadians haven't had a discussion with their family members or healthcare providers. So we really want to bring notice to this very neglected part of South Asian healthcare that we think everybody should have access to and everybody should provide for their families, so they're not stressed when it comes to the time of not being able to make that decision for themselves.
And so aside from what they want to do in certain health situations, it's also about their beliefs. Like, I understand that at least in the Sikh custom, you take the deceased body to the funeral home, and it's washed by close members of the family. And I, for one, know that a lot of people in my age category don't want anybody in their family cleaning their body.
Well, actually, that's a good point. So I think that is something that would be confusing for people who have grown up with that belief of what are we supposed to do and what do you want done to you. So I think that's an excellent point.
And where to spread the ashes, and whether you want a religious service before or after, whether you want a funeral, whether you want another type of a celebration of life. So all of that is important for you to be the one to make the decision, and not family members that may not know what your wishes were.
But getting back to the medical aspect of it, when there's so from a physician point of view, if there's no prior documentation, or the physicians in the hospital don't know what you want, very often they will go to the end of the earth, and that may not be what the person wanted. So what happens then is that it is very frustrating for the family. Obviously, the patient is not in a position where they can comment, but may have gone against their wishes. So the best is to have that documented, so that everyone's on the same page and there isn't any unnecessary suffering for the patient or the family.
I think that anyone who's working in the ER, I see this unfortunately far too often. If someone comes in without an advanced care directive, there are times where we have to start chest compressions, and we don't know how long we're going to have to continue it for until we find out from a family member that comes in afterwards, or looking through the patient's chart. But if it's not immediately available to us, I don't know if any of you have ever seen chest compressions being done. It's hard enough to watch it on someone that you don't know, but then to have it being performed on a loved one, it can get pretty violent. Yeah. So it's not done lightly. We don't like to do it on someone that we think has a really little hope of survival, but it's something that we have to do if we don't have an advanced directive.
So even for those people who think, well, I'm going to be dead anyways, why does it matter what I want? It's not about what you want. It's about making the decision so your family members can execute in a way where they don't have to make the decision for themselves.
There's lots of benefits of having an advanced care plan. You are in charge, as much as we can be in charge, of your quality of the end of your life. You are you're satisfied, your family's satisfied, you're reducing the burden on the healthcare system, the mental stress on your family. There's less ICU stays because of that. You can use hospice care where it is appropriate, so the person is not suffering. Less stress, less anxiety. Yeah. So overall, it's really to your advantage and your family's advantage to have advanced care planning.
Okay, so we've talked about why it's important. And so now, if you've decided that you want to do this and you want an advanced healthcare plan, um, where do you start?
So you want to think of it. Like a checklist. You want to think about what you want, what your wishes are, and think about who you want to make as your substitute decision maker. That's the first thing. The second is you want to talk about it with your family members, including, of course, your substitute decision maker and your healthcare provider. And finally, you want to plan for how you would make this happen and what legal documents do you need to sign. Who do you need to tell this to? Who are your witnesses? And then at any point, remember that you can review all of this information. So if you don't like what you've decided, you can always change your mind later as long as you've got something on paper.
That's important. You can always change your mind, but have something going.
Yeah. So in terms of like how do you think about what you want to have done? So we've talked about, what are your important values? What are your religious beliefs? What are your morals? What do you want your children to know? Who's important to you in your life? And it may not be your child. It may be somebody else that's more meaningful to you that you decide to make your temporary substitution decision maker. What makes your own life meaningful? Like, what is it that you want to be able to do? I remember when a loved one was in the ICU a few years ago, and the intensivist physician came and sat us down and said, said to his children, said, would you want him to be alive if you couldn't attend your children's soccer games, if you couldn't participate in Christmas parties or get-togethers? Would you still want him to be alive if he couldn't enjoy the things that he normally enjoys doing, spending time with family? And it was a very sort of poignant question that made everybody in the room sit down and think about, it's not what we want. We would love to have this person stay, be alive and alive for a long time, but what would their quality of life be like? So I think that's a very, very important question that only the person that's making this decision should make the decision about. And then, if you were to get very sick, what would matter most to you? So would you be concerned about your finances? Would you be concerned about the fact that you can no longer work or provide for your family members? Would you have to leave your home or even your community to receive care? So if you're living in an area where you don't have those services available to you. And then finally, as we kind of alluded to, what kind of medical treatments would you want? Would you want to have your life sustained through either chest compressions, which could potentially break ribs and still not help you survive to even hospital discharge? And would you want to have mechanical ventilation, i.e. would you want to have a tube down your throat and a machine that was breathing for you should you not be able to breathe on your own? So those are all very, very valid questions that people struggle with, but the more time you give them to think about, rather than making a rush decision when they're, rushed into the ER, it's better to have that decision made ahead of time for all involved.
And like you said, you can rethink it and decide a year from now that you've changed your mind, right? You don't want to, be resuscitated in a certain situation, or whatever it is, you can change your mind, but it's important to have it in place now.
One other thing I want to bring up that I forgot in terms of having medical treatments. We talked about CPR, chest compressions, and ventilation. One other thing that I find in our community, especially, is feeding tubes.
Yes, I was going to bring that
Yeah,
up.
what are you talking about that?
Well, there's a sort of a false sense of security that, they have a feeding tube. It's you just keep doing it. But this is what I get frustrated with. It's not about us. It's about the person. So unfortunately, I lost my father a couple of years ago, and he always said, "Main turda hirda jana chahunda." He's completely healthy, and I had talked to him half an hour before, and he passed away suddenly. And how I deal with it is, it's not about me. It was his journey, and his journey was to go away just as he had come, without not knowing that you're being born. You did not know he was going to die. What a wonderful way to complete your journey. So I'm happy for him. Of course, I'm sad, but it's not about me. So I think that's how we have to look at feeding tubes, chest compressions, and being ventilated. It's not about you, it's about the person. So I wouldn't want a feeding tube. I wouldn't want to be sustained by a feeding tube. So you can't just make it about you, or that you're trying to save the person and you're a bad person for allowing them to leave this earth. Because one beautiful thing we say in our culture is, when someone dies, "O pure ho gaye," and it is the completion of a journey. So we all have to allow that journey to come to an end.
Like
It can't be an ongoing journey. There is an end to the journey, right? We are not in charge of when that end is, just as we are not in charge of when the beginning is. So let's try to make the departure as wonderful and as seamless as we can. I think it's a travesty not to do this. I think my mother has an advanced care plan. we have advanced care plan. I don't want to be in a position where I do something to disrespect my mother, and I don't want to put my children in a position where they would have to make those very difficult decisions for me. So I think it's an act of love to have this in place for your loved ones.
So it's a tough thing to think about. It's tougher to talk about it. And then once you've done those 2 steps, the next step is then to plan for it, right? And then review it maybe on a regular basis with the person that's listed as your.
Well, when your favorite child changes, then you.
Hopefully that won't change so much.
What? You have a favorite child?
Yeah, exactly. That's
Yeah.
my next question.
Yeah.
So what do we do after this? Advanced care planning, and then I know we're going to talk about power of attorney. Does that mix up with this as well?
Yeah.
So should I talk about that?
Yeah. So I just wanted to mention power of attorney briefly because there's just so many terms that we're throwing around today. We're throwing around wills, which is the vasiyat and the marzi. We're throwing around advanced care planning, which is the medical. What do you want for your medical future? And then there's a power of attorney. So power of attorney in Canada anyways, I'm not sure what it's like in other countries. So a power of attorney is a legal document that allows someone to appoint another person as their attorney. And that person can then act on their behalf in terms of financial or legal matters while they're still alive. So this is not after death or when they're incapacitated necessarily, but it basically gives that other person authority over their bank finances, over their estate holdings, anything, so they can manage it either specific purposes or general purposes. And the reason, again, we would consider suggesting this and advise doing this is because you don't know at some point if you, again, are starting to suffer from cognitive decline, as in dementia, or you become physically incapacitated. You don't know when your situation will change, and it's important to have someone in place already to take over and manage your financial and legal affairs before it's too late.
There's different. You can talk to your bank and stuff. There's different steps to it, so to speak. So I can help my mom do her stuff, but she's still in charge. So I can't just, start nilly-willy doing so. So there's a safe process to do this.
Yeah.
So you have to look at that. And one thing I would urge all South Asians is, especially I see this in women, like if their husbands die, then they feel they should give everything to their children. No, you are in charge. It's your wealth. It's your property. It's your jewelry. You have it until you die and have it delineated in your will who gets what, because you can't lose that autonomy as you get older. That's
And
something
so
I will say.
important, especially if you are suffering from dementia, to make sure you've made those decisions while you are still able to make those decisions. Otherwise, they will not be legally allowed either, right? And of
Exactly.
course, you'd have to consult with a lawyer, but the sooner you do it, the better for everybody.
So one thing I did want to mention, a story that I forgot to mention, Dr. Dow talked about Advanced Care Directive, which is a legal form. One thing you can do with your primary care provider is the MOST form. And that is really easy to do. We usually have them in our offices, or you can get it off the internet and print it out. And that's just basically saying it's a medical order for the scope of treatment. So you could read it. If this happens, I can do this. It's actually quite easy to check it off. And it's an easy form. So a few of my patients have it, but I would say the majority don't.
And you call this the MOST?
MOST.
Perfect.
You fill it out at your doctor's or healthcare provider's office. And what it does is it tells you, like, for example, if you were to suddenly collapse at home and your family calls the ambulance, when the paramedics arrive, you can have this in a prominent place, like on your fridge. And it says, if this happens to me, these are my wishes. I do not want CPR. I do not want to be intubated. So they'll know how far to go, even at the point where they first get to you.
Or you could say, I want it all.
Yeah, alternatively, right? Save me at all costs.
Save me at all costs.
That's right. Yeah. And I also think along the lines of everything else we're talking about, we've kind of, again, mentioned this as well. If you have one person as your substitute decision maker for your medical care, if you have one person as your power of attorney, then it's made very clear to the rest of the family members. There can be no disputes or arguments like, well, so-and-so promised me this, or I was told this, or I should decide what mom wants, or I should decide how long dad is going to be staying in hospital for. All of those decisions are then put on the shoulders, unfortunately, or fortunately, on one person who is very well aware of what that person's wishes are. Yeah. And I think it's the best way to do it.
Yeah. And think of all the land disputes that have happened in, not even so far away generations, where it's about the land in India and who's going to get it. Like, if there was a will, if there was, some foresight into thinking about this, you'd still have families that are intact instead of divided.
Yeah.
Any final thoughts?
I would just say that, our whole basis of this podcast episode is to help our South Asian counterparts, our generation, the generation ahead of us, and the generations to come, learn how important these types of documents are and how they would actually aid in family estate planning and health planning and just, lead to family harmony. And don't rely on the kids to just make these decisions for you. This is your decision to make.
I think just echoing what I said earlier, it's just a kind and respectful way to end our journey in life.
It comes full circle, doesn't it?
It does. It literally does.
Well, thank you, Dr. Madhu and Dr. Nav. I'm Roop, and we are happy to take any more requests for subjects that we should talk about. This one was advanced care planning, and we hope you'll actually take action with you and your loved ones and put those plans together so that should something happen to you or your loved ones, there's an action plan in place. Thanks for listening to Avaz, a podcast about South Asian women's health issues. Please join us on Instagram. We're on Facebook. We're on Twitter, the X, and you can watch us on YouTube as well. Send us your DMs with requests, suggestions, and please share this.
The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.